Okay, hi guys. Hope you're safe, hope you're healthy. You're gonna be coming back soon. We're doing this video so that you can see some of the changes that have been made since you guys were here. So I'm basically just gonna narrate this because everybody's wearing masks and you can't hear them anyway. So I'll tell you what we're doing and hopefully it'll run a lot quicker here. So as the patient, I'm coming through the door. First thing that's gonna happen is the cans are here. There will be somebody from the optical that will be making sure that this area is clean and then instruct them forward. So they're gonna go ahead, do their own hands, wipe them up good. The cleaning person is going to ask the questions that were asked at scheduling. One, do they have a cough, a fever? Do they have any breathing issues, respiratory? Have they gone outside of Minnesota? We want to make sure that the answers that they gave the scheduling people, they give here and they give the text is all no and they're ready to go for their appointment. I came in without a mask, so again, the cleaning person that is at the door here will hand a mask, a surgical mask. I'm not going to touch them because I've touched far too many. They'll give a surgical mask for the patient, and if they have somebody that's coming with them, they'll get one of the cloth masks, which will only go if it's someone like an interpreter, maybe an elderly person that has someone bringing them with, but somebody that has to assist, they will also have one of these. We've actually had a lot of people come through the door with masks on, so it hasn't been much of a problem. You'll see that there are lines on the floor. They are marked as 6 feet apart, so that way the person at the door will know that this is as many people that we can let in the door at one time. If this line is full, the person will either be left back there or outside the doors, but depending on the weather. So for the most part, we've got this all marked out. This patient here will wait until the receptionist goes ahead and calls them up to the front desk to now take their information. As you can see on the floor here, we have the carpets are 2 feet from the counter. So what happened was we put the carpets there thinking that they wouldn't need to be marked, but people weren't using them correctly, so we've now marked them. So if I had my receptionist here, I would come up to the line here and I would stand here and wait for interaction with the receptionist. Now, a couple of things. If you're a new patient, let's say you have a new patient or somebody that has a new card or whatever, you, as a receptionist, will ask them to step forward and hand you the card. So that's the only time that they will pass off the card. So I would step forward, hand them the card, I would step back and wait for her to get her stuff done. If she has paperwork, she's gonna hand it to me on a clipboard like you always do. I will take the clipboard and you will instruct them that the pen is now theirs. So hopefully they will not give you that pen back. You will instruct the patient of where they get to sit. As you can see, if we scan around, we've taken a lot of chairs out, and so now we have compartment seating. So let's say we've got Dr. Peterson is here, and he's going to have this side as his compartment seating. So we know, the receptionists know, and the techs know that Dr. Peterson's patients are right there. You can see that if it's 2 chairs, it's because they have a guest. If it's 1 chair, it means that they're by themselves. So even if they're by themselves and there's nowhere else to sit, if they sit in a compartment, that means that they have to sit there alone. So no other patient that is not with them cannot sit there, all right? So as you can see, Angela has gloves and a mask on, so she will be interacting with those materials on all day long. It takes some getting used to. You guys started to a little bit before you left, but it does take you a little bit to get used to some of those things and the breathing and that sort of thing. So we'll go over more specific things as we go along. All right, so then we're going to come over here. I've been instructed to sit at this station. All right, so this means that either I have someone with me because I'm sitting in a compartment with double chairs. I have someone with me and or there was nowhere else to sit. So we're gonna go over what's gonna happen after the patient is called away from their compartment seating, then the cleaning begins. And this will be done by somebody from optical that has been assigned to do this for now. As we get going down the road, this might have to be something that you'll end up doing, but what you'll do is you start with anything that the patient may have touched right away. So obviously the arm area you want to touch right away, top of the table, edges of the table, all right, and the arms. We're gonna assume that somebody was here, only because you guys aren't always going to remember who was there. Maybe they didn't like that chair, so they moved over to this chair. So we just have to make sure that we're assuming that everything is clean, okay? So after you've done the arm portion of it, you want to be really careful with the Lysol. It can get heavy after a while, so you do a high sweep over the top, and that's it. You should let it just spray out. It doesn't have to be swish, 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 okay? All right, so as far as the cleaning then, the front desk or the optical will be helping with that. I mean, if you get a chance to, you can certainly come out and take care of any of that. For yourselves, if you're wearing gloves all day long, you'll be handed a pair of gloves in the morning, and you can sterilize them by using your pump spray. Use them all morning long. If you take them off, well, obviously, if you're take them off, then you want to lay them out on a clean towel, make sure that they're sterilized, and you can use them again. So I think Angela, those guys have been using them all day. We'll see how it goes, but maybe one pair in the morning, one in the afternoon. Your mask will be all day. Matter of fact, it'll be all week. So once you have worn your mask for the day, you spray the mask, both sides, and then you hang it and let it dry overnight, and it's just fine for the next day. So other than that, I can't think of anything else right now. Stay healthy, stay safe, and we'll see you soon.